When the implants were introduced, so the conventional technique or the two-piece implants was the one to be introduced as the part of the dental treatment. When we speak about the conventional method and the single-piece implant, we need to understand the difference between the functioning of the technique that we use. When we speak about the single-piece implant, it's a single component. Like the implant and the abutment is a single unit. We definitely have to load the implant after the implant placement. That means we need to immediately deliver the crown. There's no option of delayed loading in single piece implants, whereas the conventional. So how does the conventional technique works? It's called two-piece implant. Now in the two-piece implant, one is the implant, the other one is the connector or the abutment. The principle is you place the implant into the bone and you allow the implant to osseointegrate, so which would take roughly around 4 to 6 months time period. After which we're going to load or connect the abutment component or the connector, and then we're going to deliver the crown. That takes a period of 4 to 6 months after the implant osseointegrates. So initially when introduced the single piece implants, it was introduced as a transient implant, as an intermediate implant, wherein for a short period we can use with the physical locking of the implant, we can load onto the implants as a temporary part of the treatment, and then whatever implants we are positioned between these transitional implants, we're going to open them up and then we're going to load the permanent processes on the conventional implants. But over a period there have been changes in the studies, and many of them have started practicing single piece implants for full mouth rehabilitations as well as single or two teeth replacement. Now when we speak about the long-term success of single piece implants, basically the implant component or the implant and the abutment is connected with the collar, which is malleable after the implant placement. We bend to a certain angle, so we can bend that once or twice or max thrice, so it cannot be bent more than twice. So that means the collar is going to get weak. We only have an option to bend the collar once immediately after the implant placement. Now this collar in long run, is it strong enough to hold the forces of the occlusion? So is it advocated for everyone, or is it very selective to certain individuals, is a question that we need to ask ourselves. Whereas on the other side, the conventional technique, which has the implant component and the connector or the abutment separate. So when we place the posterior implants, so you have occlusal factor. So when you have constant occlusal forces working on the implant, so is it going to affect the implant bone osseointegration, or how are going to be the long-term results after placing the implant placement? Understand that concept. Can we not load this two-piece implant? Are there any specific conditions that we can load this two-piece implant? Yes, definitely. We can load the two-piece implants. We advocate full mouth treatment plans, like in All-on-4, even otherwise the conventional straight technique straight implants. We can load all the implants which we place, be it 6 or be it 5 or be it 8. When we deliver the immediate processes, when we load onto these implants immediately, it acts as a splint. So that's a technique where all the implants will share equal amount of forces. Now, of course, it's temporary. There wouldn't be too much of forces that would act on the posterior aspect. So only on the anterior occlusal table we would maintain all the forces so that the posterior implants are not affected. And of course, in that time frame, patient is asked not to have or not to chew any food that needs a lot of churning. So you have to, of course, be on soft diet. Basically, two-piece implants also can be loaded, wherein the system or the principle of healing is with the splinting. So this is proven successful technique even in long run. So when you compare single piece and the two piece, yes, you can load single piece immediately because that's the basic concept with single piece. Of course, even with the two piece, you can have immediate loading when it's full mouth case. When it is an isolated case of 1 or 2 implants, yes, we keep the crowns or the teeth that we deliver under occlusion so that there's no immediate active occlusal forces that act on the implant, which would affect the implant bone osseointegration. With our experience in the past treating over thousands of implant patients at FMS with single piece and two piece implants, we have had very good result with both single and two piece implants when advocated or performed selectively. Like predominantly we have done two-piece implants. So both when advocated appropriately according to the clinical situation, both do give good and successful results in the final outcome.